Hi, my name is Paul Howlett. I'm one of the dentists and one of the partners here at Queenswood Dental Clinic in Billingham on Teesside. Yeah, Queensway has been a clinic that's been very proud of providing NHS services for a lot of years. Paul, who's our most senior partner here, has had the practice for virtually 25 years now, and in that time we've looked after literally thousands and thousands of patients under the NHS, both providing general dentistry and more specialised services such as sedation and oral surgery. And it was a decision that we came to over a long time. We pride ourselves in providing the best quality care that we can for patients, making sure that we use the most modern of equipment, materials, have a really well-trained group of staff that support us in doing that. And unfortunately, under the current constraints of the NHS GDS contract, we got to a point where we just felt this was unsustainable for our business to continue. We recognised that this was potentially going to have a big impact on our patients, but felt it was the right decision for us to do on a professional level to make sure we could continue to deliver the kind of dentistry that we feel passionate about, and we feel that both us as partners and the wider team around us wanted to be able to provide, so that our patients got the best possible care that they could. So we thought about this very carefully. We thought about the kind of plan that we wanted to have. We explored various options, but we felt that Patient Plan Direct gave us the best fit for what we wanted. The core of our practice is making sure that we get the most basic of care and those fundamentals correct for patients first, so making sure that they're properly assessed, properly diagnosed, that they understand the importance of high quality prevention, and having that good solid foundation with their dentist and the dental team is absolutely crucial. And we felt therefore the package that Patient Plan gives us allowed us to get off on that right foot with our patients, where they were confident that their core services were covered, but then that we could also give them some incentives so that as and when treatment was required, there were some benefits to be had. Some of the wider insurances, which is obviously a great thing for patients in terms of care if they're away on holiday or visiting friends and family elsewhere in the country. And we felt for us that was a better way to start and a better fundamentals to have, rather than going for a sort of full care package which other providers might have instead. It's been a really good relationship so far, and obviously hopefully we can that continues for many years to come. But it's been great. We were able to have good input and good advice from you guys from the very outset when that decision was made, long before we got to the stage of communicating with our patients. Also, the support that we had through thinking about how we were going to first and foremost communicate that with our team, make sure they understood the reasons why we felt it was the right decision to make. More importantly then, that they understood what the offer was that we were making to our patients, so they could communicate that clearly and effectively. Getting Patient Plan to come in and provide some staff training sessions, be present at wider training that we did around communication with patients, using body language. All those kind of things was a great way of integrating this change into our practice, and using the expertise and experience over many other practices that Patient Plan have to help us make that change as smoothly as we possibly could with our team, and then obviously leading on to our patient base. Really well. I mean, I suppose it would be fair to say it's a little bit early to say. As you say, we're only 3 months into the change. But so far it's been very positive. Obviously, patients understandably it's been a big change, and some of them it's been a little bit of a shock that we've stepped away from the NHS. But I think with the support we've had from Patient Plan, patients have really understood why we've made that decision. I think they're understanding that we're doing it for the best possible reasons, to make sure that we can invest in providing the best quality care for them. And that's really made that transition very smooth. Patients in the main have bought into that. They've understood where we're going and want to be part of that journey with us. And also I think through the engagement we've had with Patient Plan, it's made such a difference having our team being 100% behind that. We're a big practice here. We employ over 100 staff, and having that full team that can be committed to supporting and implementing that change has been absolutely crucial in our patients coming with us on that journey. So all of that is something that inevitably has taken a lot of planning, a lot of thought, and something that Patient Plan have been first class really at supporting us through that process from the very beginning, and continue to be so, and I'm sure will continue to be into the future as well. you can't do that in life, can you? No, I think no, definitely no regrets would sum it up. I think it's a decision that we've thought about a lot over a long period of time, taking advice from lots of people, including patient plan. And I think the decision is definitely one that we do not regret. And I'm sure as we get a few more months down the line, we'll say it was 100% the best decision that we ever made. But yes, I think it's already, both our clinical team and our wider staff are seeing that it's enabling us to work in a way that is much more rewarding, much more fulfilling, enable us to do the kind of dentistry and the kind of customer service, patient care that we aspire to, and that's very, very exciting, and I'm sure will continue to be so.